Question 1. You are working with a client on identifying animals. When you hold up a picture of a dog and say dog, the client says dog. This type of verbal behavior, where the speaker repeats what someone else said, is called A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer C. Echoic. This question is about identifying different types of verbal behavior based on how they are controlled. An echoic is when a person repeats something they just heard another person say. The clue here is that you say dog, and the client says dog right after. This is imitation of a sound or word. A mand is asking for something. A tact is labeling something seen or heard, and an intraverbal is like answering a question or having a conversation. When you repeat what someone else says, you're emitting an echoic. Question 2. Your supervisor asks you to collect data on how long a child engages in crying during a 15-minute play session. Which measurement method should you use? A. Frequency. B. Duration. C. Latency. D. Momentary time sampling. Answer B. Duration. This question asks about the best way to measure a specific aspect of behavior. The key phrase is how long, which tells you need to measure the length of time the behavior occurs. Duration is the measurement of how long a behavior lasts from start to finish. Frequency is counting how many times it happens. Latency is the time between a cue and the start of the behavior. Momentary time sampling checks if the behavior is happening at a specific moment. Since you need to know how long the crying lasts, duration is the correct measure. Question 3. A client sometimes screams when a demand is placed. You record that before the screaming. Antecedent. The demand clean up toys was given. The behavior was screaming. After the screaming, consequence, the demand was removed, and the client did not have to clean up. Based on this ABC data, what is the most likely function of the screaming behavior? A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer B. Escape. This question asks you to interpret ABC data to determine the function, the purpose of a behavior. The clue here is the sequence. A demand is given, antecedent. The behavior occurs, screaming, and the demand is removed, consequence. When a behavior happens because it successfully gets the person out of or away from something unpleasant or a demand, its function is escape. Attention would involve getting noticed by others. Access to tangibles would involve getting an item. Automatic reinforcement is getting an internal feeling. Getting out of cleaning up strongly points to escape as the function. Question 4. You are teaching a client to wash their hands using a task analysis. You prompt them through all steps except the last one, drying hands. When they independently dry their hands, you provide reinforcement. Once they can do that consistently, you will prompt all steps except the last two, and so on. This is an example of A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer B. Backward chaining. This question describes a specific way to teach a multi-step skill. In backward chaining, you teach the steps of a task analysis starting with the last step. The instructor does all the steps up to the last one, and the learner completes the final step, which is often the most naturally reinforcing part, like the hands being clean and dry. Once the last step is learned, you teach the second to last step, then the last step, and work backward through the chain. Forward chaining starts with the first step. Total task presents all steps at once. Shaping teaches one behavior by reinforcing approximations. Teaching the steps from the end to the beginning is backward chaining. Question 5. According to the RBT Ethics Code, your primary responsibility is to A. Your supervisor. B. The client. C. Your employer. D. Yourself. Answer B. The client. This question is about the fundamental ethical responsibility of an RBT. While you work under a supervisor and are employed by an agency, your most important ethical duty is always to act in the best interests of the client. The RBT Ethics Code prioritizes the client's well-being, safety, and right to effective treatment above all other considerations. Your decisions and actions should primarily benefit the person you are working with. Question 6. When a behavior is followed immediately by the presentation of a stimulus, and as a result, the behavior happens less often in the future, this is called A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Extinction. Answer C. Positive punishment. This question asks about a type of consequence that decreases behavior. The keywords are followed immediately by the presentation of a stimulus, something is added, and the behavior happening less often in the future. The behavior decreases. When you add something after a behavior and it makes the behavior less likely, it's positive punishment. For example, if you touch a hot stove, behavior, and feel pain. Adding a stimulus, you're less likely to touch it again. Remember, positive means add, and punishment means decrease. Question 7. You are collecting data on how many times a student calls out in class during a 20-minute independent work period. You simply make a tally mark each time they call out. What measurement method are you using? A. Duration, B. Frequency, C. Latency, D. Partial interval recording. Answer B. Frequency. This question is about measuring how often a behavior happens. When you count every single time a behavior occurs within a specific time frame, that's called frequency recording or count. Duration measures how long it lasts. Latency measures the time until it starts. Partial interval recording is a discontinuous method where you mark if it happened at all during an interval. Making a tally mark each time is the classic way to measure frequency. Question 8. You are teaching a client to point to different pictures when named. When you say touch cat and present pictures of a cat and a dog, the client touches the cat. When you say touch dog and present the same pictures, the client touches the dog. The client is learning to respond differently to different verbal cues. This is an example of A. Generalization, B. Discrimination, C. Shaping, D. Prompting. Answer B. Discrimination. This question is about discrimination. Discrimination is when a person learns to respond differently to different stimuli or situations. The client is learning to discriminate between the words cat and dog and respond appropriately to each one when presented with multiple choices. Generalization is responding similarly to different stimuli. Shaping teaches new behaviors through approximations. Prompting is providing help. Responding correctly to one cue but not another is demonstrating discrimination. Question 9. When a behavior occurs less often because it is followed immediately by the removal of a stimulus, this is called A. Positive punishment, B. Negative reinforcement, C. Negative punishment, D. Extinction. Answer C. Negative punishment. This question is about a type of consequence that decreases behavior. The keywords are followed immediately by the removal of a stimulus, something is taken away, and the behavior happening less often in the future. The behavior decreases when you take away something a person likes or wants after a behavior, and it makes the behavior less likely. It's negative punishment. For example, if a child misbehaves, behavior, and you take away their tablet, removal of a stimulus, and the misbehavior decreases, that's negative punishment. Remember, negative means remove and punishment means decrease. Question 10. You are working on a skill acquisition program with a client. The plan says you should provide reinforcement on a VR5 schedule. What does this mean? A. You reinforce the first correct response after a fixed time of 5 minutes. B. You reinforce the first correct response after a variable time that averages 5 minutes. C. You reinforce every fifth correct response. D. You reinforce on average every fifth correct response. Answer: D. You reinforce on average every fifth correct response. This question asks about interpreting a specific reinforcement schedule. VAR stands for variable ratio. Variable means the number of responses required for reinforcement changes each time, but it averages out to a specific number. Ratio means it's based on the number of responses, not time. So, a VR5 schedule means reinforcement is delivered after a variable number of correct responses that averages out to 5. Option A is fixed interval, FALI. Option B is variable interval, VI. Option C is fixed ratio, FR. When you see VR, think variable responses, average number. Question 11. A written plan that details how to teach a specific skill, often broken down into steps, is called a A. Behavior Intervention Plan, BP. B. Functional Behavior Assessment, FBA. C. Skill Acquisition Plan. D. Preference Assessment. Answer: C. Skill Acquisition Plan. This question asks about the document that guides teaching new behaviors. A skill acquisition plan is a written plan that outlines the procedures for teaching a specific skill to a client. It usually includes the target behavior, materials needed, prompting strategies, reinforcement schedule, and data collection method. A behavior intervention plan, BIP, focuses on decreasing challenging behaviors. An FBA is the process of determining why a behavior occurs. A preference assessment finds what a client likes. If you're teaching a new skill, you'll follow a skill acquisition plan. Question 12. You are collecting data on aggressive behavior using partial interval recording with 1-minute intervals. If aggression occurs for only 10 seconds within a 1-minute interval, how would you record it? A. You would mark the interval as occurring. B. You would not mark the interval. C. You would record the duration, 10 seconds. D. You would record the frequency. 1. Answer: A. You would mark the interval as occurring. This question tests your understanding of partial interval recording. In partial interval recording, you record the behavior as occurring if it happens at any point during the interval, no matter how brief. The clue is at any point. So, even though it only lasted 10 seconds within the 1-minute interval, you would still mark that interval as containing aggression. Whole interval requires it to happen throughout. Duration records the length. Frequency counts each instance. Partial interval is about whether it happened at all within the block of time. Question 13. Which of the following is not a common function of challenging behavior? A. To gain attention. B. To escape a task. C. To access sensory input. D. To demonstrate knowledge. Answer: D. To demonstrate knowledge. This question asks you to identify something that is not typically considered a primary function of challenging behavior in ABA. The 4 commonly accepted functions are attention, getting notice; escape, getting away from something; access to tangibles, getting an item or activity; and automatic reinforcement, getting sensory input or an internal feeling. Challenging behaviors usually serve one of these purposes for the individual. Demonstrating knowledge is a skill or an outcome of learning, not generally the underlying reason why a challenging behavior happens. Question 14. You are preparing for a session and notice that the client's favorite toy, which you often use as a reinforcer, is broken. This event, the toy being broken, will likely function as a blank for behaviors that usually earn access to that toy. A. Discriminative stimulus, SD. B. Establishing operation, EO. C. Abolishing operation, AO. D. Conditioned stimulus, CS. Answer: C. Abolishing operation, AO. This question is about motivating operations, MOs. An MO changes the value of a reinforcer or punisher and affects the likelihood of behaviors that have been associated with it. An abolishing operation, AO, is a type of MO that decreases the effectiveness of a reinforcer. If the toy is broken, it is no longer reinforcing, so the AO, the toy being broken, decreases its value as a reinforcer and makes behaviors that usually earn the toy less likely. An establishing operation, EO, would increase the reinforcer's value. An SD signals reinforcement availability. A CS is from classical conditioning. Something making a reinforcer less desirable is an AO. Question 15. When using discrete trial training, DTT, each trial should generally start with the therapist presenting a clear instruction or cue. This instruction or cue is called the A. Consequence, B. Behavior, response, C. Reinforcer, D. Discriminative stimulus, SD. Answer, D. Discriminative stimulus, SD. This question asks about the specific term for the instruction in a DTT trial. In a discrete trial, the trial begins with the discriminative stimulus, SD, which is the instruction or cue given to the client that signals the availability of reinforcement for a specific response. The client's action is the behavior, response. What happens after the behavior is the consequence, which could be a reinforcer. The SD is the signal to do something because reinforcement is possible. Think of the SD as the go or the show me cue. Question 16. You are tracking a behavior plan that requires you to record data on a student's on-task behavior every 10 minutes. At the end of each 10-minute interval, you look up and record if the student is currently on task. What measurement method are you using? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer, C. Momentary time sampling. This question describes momentary time sampling. In this discontinuous measurement method, you divide the observation time into intervals and record whether the behavior is occurring only at the precise moment the interval ends. You just check right now. Partial interval records if it happened at any point during the interval. Whole interval records if it happened throughout the entire interval. Duration records the length of time. Looking up exactly when the timer beeps is momentary time sampling. Question 17. According to the RBT Ethics Code, when communicating with a client's family, you should A. Explain the client's diagnosis and prognosis. B. Discuss specific details of the behavior plan design. C. Explain the basic principles of ABA and how they relate to the intervention, if within your role and competence and always under supervision guidance. D. Discuss details about other clients you work with who have similar behaviors. Answer. C. Explain the basic principles of ABA and how they relate to the intervention, if within your role and competence and always under supervision guidance. This question is about the RBT's role in communicating with families. As an RBT, your role is to implement the plan and collect data under supervision. While you interact directly with the client and family, you should not discuss diagnosis/prognosis, A. Design the plan, B. Or discuss other clients, D. Due to confidentiality. You can, however, explain basic ABA concepts and how the implemented parts of the plan work, but this should always be done within the scope of your training and with guidance and direction from your supervisor. It's crucial to know your limits and defer clinical interpretation and plan design to your BCBA. Question 18. A child is engaging in screaming behavior. The behavior analyst determines the function is escape from demands. An appropriate differential reinforcement procedure to implement might be A. Reinforcing the child for screaming louder than before. B. Reinforcing the child for being quiet for a specific interval of time. C. Reinforcing the child for asking for a break, e.g., saying break instead of screaming. D. Reinforcing the child for screaming only when no demands are present. Answer, C. Reinforcing the child for asking for a break, e.g., saying break instead of screaming. This question asks you to apply knowledge of differential reinforcement based on a behavior's function. If screaming is for escape, A good strategy is to teach and reinforce an alternative, appropriate behavior that achieves the same function, escape. Asking for a break allows the child to escape the demand in a more acceptable way. Reinforcing louder screaming, A, is positive reinforcement for the problem behavior. Reinforcing quiet, B, is DRO, which might work but doesn't teach a specific escape alternative. Reinforcing screaming when no demands are present, D, wouldn't address the function of escape. Reinforcing a functional alternative, DRA, is often the most effective approach for escape-maintained behavior. Question 19. A stimulus that signals that reinforcement is available for a specific behavior is called in A, S delta, SD, B, motivating operation, MO, C, conditioned stimulus, CS, D, discriminative stimulus, SD. Answer D, discriminative stimulus, SD. This question asks about a stimulus that cues behavior because it has been associated with reinforcement. A discriminative stimulus, SD, is a stimulus that, in the past, has been present when a specific behavior was reinforced. It signals that performing that behavior now is likely to lead to reinforcement. An S delta, SD, signals that reinforcement is not available. An MO changes the value of the reinforcer. A CS is from classical conditioning. Think of the SD as the green light for a particular behavior to get a reward. Question 20. You are teaching a client to build a tower with blocks. You break the skill into these steps. 1. Pick up block. 2. Place block on table. 3. Pick up second block. 4. Place second block on first block. When you teach the first step, pick up block and reinforce it, and then plan to teach the second step next, and so on. You are using A, backward chaining, B, total task presentation, C, forward chaining, D, shaping. Answer C, forward chaining. This question describes forward chaining. In forward chaining, you teach the steps of a task analysis in the natural order, starting with the first step. You reinforce the first step until it's mastered, then teach the first 2 steps and reinforce completing those, and continue adding steps from the beginning until the whole sequence is learned. Backward chaining starts from the end. Total task teaches all steps at once. Shaping teaches one behavior by reinforcing closer and closer attempts. Starting at the beginning of the steps is forward chaining. Question 21. When collecting data, ensuring that 2 independent observers agree on the occurrence or non-occurrence of the behavior is a measure of A, treatment integrity, B, social validity, C, inter-observer agreement, IOA, D, preference. Answer C, inter-observer agreement, IOA. This question is about checking the reliability of your data collection. Inter-observer agreement, IOA, is calculated by having 2 or more people independently observe and record the same behavior at the same time, and then comparing their data to see how often they agree. High IOA means your behavior definition and measurement system are clear and reliable. Treatment integrity is whether the intervention was implemented correctly. Social validity is about the importance and acceptability of goals and procedures. Preference is about what the client likes. Getting 2 people to agree on the data is IOA. Question 22. A child screams and hits their parent when asked to turn off the TV. The parent immediately turns the TV back on. The screaming and hitting increases in the future when the TV is asked to be turned off. This scenario is an example of the screaming and hitting being maintained by A, positive reinforcement, access to tangible, TV. B, negative reinforcement, escape from demand, turning off TV. C, positive punishment, turning TV back on. D, automatic reinforcement, sensory. Answer A, positive reinforcement, access to tangible, TV. This question asks about the function of the screaming and hitting. The behavior, screaming and hitting, is followed by the presentation or addition of something the child wants, the TV being turned back on or staying on. This consequence makes the behavior more likely in the future. Getting access to a desired item or activity added after the behavior is positive reinforcement, specifically access to tangibles. Negative reinforcement would be getting away from something unpleasant. Punishment decreases behavior. Automatic reinforcement is internal. Getting the TV back is the key here. Question 23. You are preparing a therapy area for a client who is easily distracted. You clear unnecessary items from the table, ensure the room is quiet, and have your materials ready. These actions taken before the session are examples of A. Consequence strategies. B. Measurement procedures. C. Antecedent interventions. D. Punishment procedures. Answer: C. Antecedent interventions. This question is about strategies used before a behavior occurs. Antecedent interventions involve modifying the environment or events that happen before a behavior to make desired behaviors more likely or challenging behaviors less likely, preparing the environment by reducing distractions, and having materials ready sets the stage for the client to be more on task. Consequence strategies happen after the behavior. Measurement procedures are for collecting data. Punishment procedures decrease behavior after it happens. Actions you take to arrange the environment before the behavior are antecedent interventions. Question 24. When collecting data on the occurrence of a behavior, you should use an operational definition that is A. Vague and open to interpretation. B. Observable and measurable. C. Focused on the client's feelings. D. Only understandable by the BCBA. Answer: B. Observable and measurable. This question asks about the qualities of a good behavior definition. An operational definition needs to be so clear and specific that anyone observing the behavior can agree on whether or not it occurred. To be clear and specific, it must describe the behavior in terms that are observable, you can see it, and measurable, you can count or time it. Vague definitions: A. Lead to inconsistent data. Focusing on feelings, C. Isn't directly observable behavior. Definitions should be clear enough for anyone implementing the plan. D. To use. Make it clear enough that a stranger knows exactly what to look for. Question 25. A therapist is teaching a client to imitate saying "ah." The therapist says "ah," and the client says "ah." The therapist immediately provides a reinforcer. In this trial, the therapist saying "ah" serves as a A. Mand. B. Tact. C. Model. D. Discriminative stimulus. SD. Answer: C. Model. This question asks about the role of the therapist's verbalization in an imitation task. When the therapist says "ah" for the client to copy, they are providing a model of the sound to be imitated, while saying "ah" could also function as an SD, cueing the client that reinforcement is available for repeating. In the context of teaching imitation, its primary function is the stimulus to be copied, which is a model. A mand is asking for something. A tact is labeling. The therapist's sound is what the client is meant to echo. Question 26. If a client's challenging behavior is maintained by access to tangible items, an effective consequence-based intervention might involve A. Ignoring the behavior every time it occurs. B. Providing attention every time the behavior occurs. C. Removing a preferred tangible item after the behavior occurs. D. Providing the client with a tangible item non-contingently on a time schedule. Answer: C. Removing a preferred tangible item after the behavior occurs. This question asks you to consider a consequence intervention for a behavior maintained by tangibles. If the behavior gets the person items they want, stopping that payoff, extinction, or taking away something they like, punishment, could be used to decrease it. Removing a preferred tangible item after the behavior is negative punishment, specifically response cost, which is designed to decrease the behavior by removing the source of reinforcement or another reinforcer. Ignoring A is extinction for attention, providing attention. B would reinforce attention-seeking behavior, providing tangibles non-contingently. D is an antecedent strategy, NCR, for tangible maintained behavior. Taking away an item they like is a punishment strategy often used when the behavior's function is to get tangibles. Question 27. You are asked to train a new behavior technician on a procedure you are very familiar with. According to the RBT Ethics Code, you should only provide training that is A. on the job without formal instruction. B. within your competence and under the supervision of a BCBA. C. whatever the new technician wants to learn. D. focused only on crisis intervention. Answer B. within your competence and under the supervision of a BCBA. This question is about the RBT's scope of practice regarding training others. As an RBT, you should only provide training on tasks that you are competent to teach and that are part of your RBT role. Crucially, any training you provide should be done under the supervision of a qualified BCBA. You do not independently supervise or train others in clinical procedures beyond your defined role and competency. Training should be structured and appropriate, not just random. C. Your role is broader than just crisis intervention. D. Always stay within your role and under supervision. Question 28. When creating a task analysis, you are breaking a skill down into A. steps the client already knows how to do. B. a sequence of smaller, teachable steps. C. different functions of the behavior. D. potential reinforcers. Answer B. a sequence of smaller, teachable steps. This question asks what a task analysis is. A task analysis is the process of taking a complex skill, like brushing teeth or making coffee, and breaking it down into a step-by-step sequence. Each step should be small enough that it can be taught and learned. It's about making the skill less overwhelming by breaking it into bite-sized pieces. It's not just any steps. A. nor is it about functions. C. or reinforcers. D. it's a step-by-step breakdown for teaching. Question 29. You are working with a client who sometimes engages in shouting. The behavior plan says that if shouting occurs, you should remove a token from their token board. This procedure is called A. Timeout. B. Response cost. C. Extinction. D. Positive punishment. Answer B. Response cost. This question describes response cost, a type of punishment. Response cost involves the removal of a specific amount of a reinforcer, like tokens, points, or minutes of playtime, contingent on the occurrence of a behavior, with the effect of decreasing that behavior. Timeout involves removing the person from the reinforcing environment. Extinction is withholding the maintaining reinforcer. Positive punishment adds something unpleasant. Taking away tokens is a direct example of response cost. Question 30. To teach a client to say ball when they see a ball, you show them a picture of a ball and say, "What is this?" The client says, "Ball." You immediately give them praise and a small piece of a snack. The spoken, "What is this?" acts as the A. reinforcer, B. behavior, C. consequence, D. discriminative stimulus, SD. Answer D. Discriminative stimulus, SD. This question asks about the role of the therapist's question. In this teaching trial, the question, "What is this?" is the instruction or cue that tells the client what response is expected to earn reinforcement in this context. This makes it the discriminative stimulus, SD. The client saying ball is the behavior, response. The praise and snack are the consequences, reinforcers. The question is what prompts the client to give the label. Question 31. A client often engages in hand flapping, even when alone, and seems to enjoy the sensory feeling. This behavior is most likely maintained by A. attention, B. escape, C. access to tangibles, D. automatic reinforcement. Answer D. automatic reinforcement. This question asks about the function of a behavior that seems to provide its own reward. When a behavior continues because the sensation or feeling it produces is reinforcing for the individual. Without needing anyone else or getting external items, it's maintained by automatic reinforcement. Hand flapping is a common example of a behavior that can produce reinforcing sensory input. Attention, escape, and tangibles involve external consequences mediated by others or the environment. If the behavior feels good or stimulating inherently, it's likely automatic. Question 32. You are supervising a child playing and see them put a toy in their mouth, which is a target behavior to decrease. You immediately say, "No, toys are not for mouths," and gently redirect the toy to their hands. Your verbal statement, "No, toys are not for mouths," is intended as a positive reinforcer, B, negative reinforcer, C, punisher, D, antecedent intervention. Answer, C, punisher. This question asks about the intended effect of a consequence. Your verbal statement occurs after the behavior, putting the toy in the mouth, and is intended to make that behavior happen less often in the future. A consequence delivered after a behavior that decreases the future likelihood of that behavior is called a punisher. Specifically, adding a verbal reprimand is often considered a form of positive punishment, adding an unpleasant stimulus to decrease behavior. Reinforcement increases behavior. An antecedent intervention happens before the behavior. Your "no" is meant to stop the behavior from happening again. Question 33. Which type of graph is most commonly used in ABA to show the changes in a client's behavior over time? A, bar graph, B, pie chart, C, scatter plot, D, line graph. Answer, D, line graph. This question asks about the standard visual tool in ABA. Line graphs are the most common type of graph used in applied behavior analysis to track individual behavior change over time. They allow behavior analysts and RBTs to clearly see trends, increasing, decreasing, stable, in frequency, duration, percentage, etc., across sessions or days. Bar graphs are often used for comparing data between different conditions or individuals. Pie charts and scatter plots are used for different types of data representation. For seeing how one person's behavior changes moment to moment or day to day, the line graph is key. Question 34. A client sometimes runs away from the table during meals. The behavior plan instructs you to physically prevent the client from leaving the table as soon as they try to stand up. This physical prevention is an example of A, timeout, B, response cost, C, response blocking, D, extinction. Answer, C, response blocking. This question describes response blocking. Response blocking is a procedure where the therapist physically intervenes to prevent the completion of a response. In this case, you are physically stopping the client from running away. Timeout involves removing the client from reinforcement. Response cost removes a reinforcer. Extinction involves withholding the reinforcement that maintains the behavior, which might be escape from eating, in this case, and simply blocking the escape might not be pure extinction. Physically preventing the behavior is the definition of response blocking. Question 35. You are training a new RBT. They ask you how to determine if a reinforcer you are using is actually effective for a client. What is the simplest way to check? A, conduct a preference assessment. B, ask the client if they like the item. C, observe if the behavior it follows increases in the future. D, ask the client's parent if they think the item is reinforcing. Answer, C, observe if the behavior it follows increases in the future. This question gets at the definition of a reinforcer. The only true test of whether something is functioning as a reinforcer is its effect on future behavior. If presenting a stimulus after a behavior makes that behavior happen more often later, then that stimulus is functioning as a reinforcer. Preference assessments, A, asking the client, B, and asking parents, D, can identify potential reinforcers, things the client might like. but only the effect on the behavior itself. C. Confirms if it is a reinforcer. Look at the data. Did the behavior go up when this was delivered? Question 36. You are collecting data on hitting behavior. You define hitting as forceful contact of the client's hand or fist with another person's body. This specific description of the behavior is a hypothesis, B. Operational definition, C. Measurement method, D. Consequence. Answer, B. Operational definition. This question asks about how we define behaviors for measurement. An operational definition is a clear, objective, and measurable description of the behavior you are interested in. It tells you exactly what counts as an instance of the behavior. The description provided gives specific criteria for what is and isn't hitting. This is essential for consistent data collection. A hypothesis is a guess about function. A measurement method is how you collect data, frequency, duration, etc. A consequence happens after the behavior. The rulebook for identifying the behavior is its operational definition. Question 37. When using a least to most prompt hierarchy, you start with A. A physical prompt and fade to a verbal prompt. B. A modal prompt and fade to a gestural prompt. C. The least intrusive prompt necessary and move up the hierarchy if needed. D. The most intrusive prompt necessary and fade immediately. Answer, C. The least intrusive prompt necessary and move up the hierarchy if needed. This question is about using prompt hierarchies effectively. A least to most prompt hierarchy means you begin by providing the minimum amount of help you think the client might need. The least intrusive prompt, like a verbal hint, if they don't respond or respond incorrectly, you then provide the next level of help on your hierarchy, example, a gestural prompt, and only move to more intrusive prompts, like physical guidance, if the less intrusive ones are not successful. This helps prevent prompt dependency. Question 38. You are working with a client in their natural environment, like the park or store. You observe behaviors as they happen naturally and use opportunities that arise spontaneously to teach skills or reinforce appropriate behavior. This approach is called A. Discrete trial training, DTT. B. Mass trialing. C. Natural environment teaching, NET. D. Errorless learning. Answer, C. Natural environment teaching, NET. This question describes natural environment teaching, NET. NET, also sometimes called naturalistic teaching, involves teaching skills and reinforcing behaviors in the everyday natural contexts where they would normally occur. It takes advantage of the client's current interests and motivation. Discrete trial training, DTT, is typically more structured and done in a controlled setting. Mass trialing is repeating the same trial many times. Errorless learning is a prompting strategy to prevent mistakes. Teaching and reinforcing within the flow of natural activities is NET. Question 39. According to the RBT Ethics Code, you should maintain the confidentiality of client information. A. Only when the client's family requests it. B. Only for clients under 18 years old. C. As required by law and your agency's policies. D. By discussing it only with your friends and family. Answer, C. As required by law and your agency's policies. This question is about client confidentiality, a critical ethical and legal requirement. RBTs are required to protect client information and discuss it only with authorized individuals, usually their supervisor and other team members involved in the client's care, and only in appropriate settings. This is mandated by laws like HIPAA in the U.S. and agency policies. Confidentiality applies to all clients, not just minors or those whose families request it, and discussing client information with people not directly involved in their care, like friends and family, is a serious breach of confidentiality. Question 40. When a client successfully performs a step in a task analysis, and that performance serves as the reinforcer for the previous step in the chain, this is called A. Automatic reinforcement. B. Conditioned reinforcement. C. Reinforcement survey. D. Chaining. Answer: B. Conditioned reinforcement. This question describes a concept related to how chaining works. In a behavioral chain, the successful completion of one step becomes the stimulus, specifically a conditioned reinforcer and an SD for the next step, that reinforces the performance of the previous step. These steps become reinforcing because they lead to the completion of the chain, which ultimately results in the terminal reinforcer. This linking of steps through reinforcement is built on the idea that each step becomes a conditioned reinforcer for the one before it. Automatic reinforcement is sensory. A reinforcement survey is an indirect assessment. Chaining is the overall procedure, but the reinforcement process between steps involves conditioned reinforcement. Question 41. Your supervisor asks you to collect data on hitting using whole interval recording with 30-second intervals. If a student hits only at the very beginning of a 30-second interval, how would you record it? A. You would mark the interval as occurring. B. You would not mark the interval. C. You would record the duration example 5 seconds. D. You would record the frequency 1. Answer: B. You would not mark the interval. This question tests your understanding of whole interval recording. In whole interval recording, you only mark the interval as occurring if the behavior happens continuously throughout the entire duration of that interval. If the behavior stops even for a moment within the interval, or only occurs for a portion of it, you do not mark the interval. So, if the student only hits at the beginning and not for the whole 30 seconds, you do not mark that interval. Partial interval would mark it. Duration records the length. Frequency counts it. Whole interval means it must fill the whole box. Question 42. A behavior analyst is teaching a child to say apple when shown a picture of an apple. Initially, they show the picture and say apple simultaneously, reinforcing the child for repeating. As the child gets better, they show the picture but only say prompting the first sound, then fade the prompt further. This process is an example of A. Shaping. B. Stimulus fading. C. Prompt fading. D. Stimulus generalization. Answer: C. Prompt fading. This question describes prompt fading. The therapist is providing a verbal prompt, apple, then along with the picture, the main stimulus, to help the child make the correct verbal response. As the child learns, the therapist is gradually reducing, fading, the intensity or completeness of the verbal prompt. Shaping reinforces successive approximations of the behavior. Stimulus fading involves gradually changing the stimulus, like making the picture clearer or smaller. Stimulus generalization is responding to different stimuli. Reducing the help given is prompt fading. Question 43. You are about to start a teaching session. What is one of the most important things to do before the session begins? A. Take baseline data on a new behavior. B. Identify potential motivating operations and gather preferred items. C. Implement a punishment procedure. D. Discuss the client's progress with their parent in detail. Answer: B. Identify potential motivating operations and gather preferred items. This question is about preparing for a successful session. Before you start teaching, you need to make sure the client is motivated and that you have effective reinforcers available. Thinking about what might be functioning as motivating operations, like if the client is thirsty or hasn't played with a toy in a while, helps you predict what might be reinforcing. Gathering preferred items ensures you have those potential reinforcers ready to go. Taking baseline data, A, might happen before intervention, but not necessarily before every session. Implementing punishment, C, or discussing progress with parents, D, are not typical things to do before a teaching session begins. They are interventions or communication roles handled differently. Get prepared to motivate and reinforce. Question 44. When reinforcing a behavior on a schedule where reinforcement is delivered for the first response after a variable amount of time has passed, averaging out to a specific duration. This is A. A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FLI. D. Variable interval, VI. Answer: D. Variable interval, VI. This question asks about a specific time-based reinforcement schedule. VI stands for variable interval. Variable means the amount of time that must pass before the first response can be reinforced changes each time, but it averages out to a specific duration. Interval means it's based on time, not the number of responses. So, a VI schedule delivers reinforcement for the first correct response after an unpredictable period of time has passed, averaging a certain length. Fixed interval, FI, uses a fixed time. Ratio schedules, FR, VR, are based on the number of responses. Unpredictable time for reinforcement is VI. Question 45. Your supervisor observes you delivering reinforcement to a client and notices that you are not delivering it immediately after the correct response, but sometimes waiting several seconds. This relates to your A. Measurement accuracy. B. Inter-observer agreement, IOA. C. Procedural fidelity, treatment integrity. D. Social validity. Answer: C. Procedural fidelity, treatment integrity. This question is about implementing the intervention correctly. Procedural fidelity, also known as treatment integrity, refers to how accurately an intervention is carried out exactly as it was designed in the behavior plan. If the plan specifies immediate reinforcement and you are delaying it, you are not implementing the procedure with high fidelity. Measurement accuracy is about the data being correct. IOA is about multiple observers agreeing on behavior data. Social validity is about the importance and acceptability of the plan. Implementing the steps of the plan correctly is procedural fidelity. Question 46. A client's behavior plan includes using a token economy. What do the tokens, like stickers or points, represent? A. They are the primary reinforcers the client is working for. B. They are unconditioned punishers that decrease behavior. C. They are generalized conditioned reinforcers that can be exchanged for backup reinforcers. D. They are simply a way to track behaviors without reinforcing value. Answer: C. They are generalized conditioned reinforcers that can be exchanged for backup reinforcers. This question asks about the function of tokens in a token economy. Tokens themselves are not naturally reinforcing. Unconditioned reinforcers, like food, their value comes from being paired with things the client does find reinforcing. The backup reinforcers they can trade tokens for. Because tokens can be exchanged for many different backup reinforcers, their value isn't tied to a single motivation state, making them generalized conditioned reinforcers. They are reinforcing, not punishing. B. And they are more than just tracking. D. Because they have learned value. Tokens are powerful learned rewards that open the door to other rewards. Question 47. When reinforcing a behavior on a schedule where reinforcement is delivered after a fixed number of responses, regardless of how long it takes, this is A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: A. Fixed ratio, FR. This question asks about a response-based reinforcement schedule that is predictable. FR stands for fixed ratio. Fixed means the number of responses required for reinforcement is constant, and ratio means it's based on the number of responses. So, an FR schedule delivers reinforcement after a set number of correct responses. For example, FR10 means reinforcement is delivered after exactly 10 responses. Variable ratio, VR, uses a variable number of responses. Interval schedules, phi VI, are based on time. Reinforcing after a specific, unchanging count of behaviors is a fixed ratio schedule. Question 48. You are observing a client and recording every instance of a behavior from start to finish. This is a form of A. discontinuous measurement, B. continuous measurement, C. indirect measurement, D. permanent product recording. Answer: B. continuous measurement. This question asks about measurement that captures all occurrences. Continuous measurement involves recording every single instance of the behavior or a specific dimension of it, like duration, frequency, latency, throughout the entire observation period. Discontinuous measurement samples the behavior, like interval recording or time sampling. Indirect measurement collects information from others. Permanent product recording counts the results of a behavior. Tracking every instance from start to finish is capturing the behavior continuously. Question 49. A therapist is teaching a child to clean up toys. They have a picture schedule showing the steps. When it's time to clean up, the therapist points to the clean up picture on the schedule. The picture on the schedule acts as a reinforcer, B. consequence, C. discriminative stimulus, SD, D. prompt. Answer: C. discriminative stimulus, SD. This question asks about a visual cue that signals an expectation. The picture on the schedule, presented at a specific time, cues the client that it's time to clean up, and that engaging in cleaning up behavior in this context will likely lead to reinforcement, example praise, access to the next activity. This stimulus that signals when a behavior is likely to be reinforced is a discriminative stimulus, SD. It's not a reinforcer or consequence. They happen after the behavior. And while it could be considered a visual cue, in this teaching context, it's specifically the SD that sets the occasion for the response chain of cleaning. Question 50. Which ethical principle requires behavior analysts to avoid conflicts of interest and maintaining appropriate professional boundaries? A. Beneficence, do good. B. Fidelity, be trustworthy. C. Justice, be fair. D. Integrity, be truthful and honest. Answer: B. Fidelity, be trustworthy. This question is about the ethical principle of fidelity. Fidelity includes being reliable, keeping professional commitments, and maintaining appropriate professional boundaries, avoiding conflicts of interest, not entering into dual relationships, like being both a therapist and a family friendie, and maintaining clear professional lines are all part of practicing with fidelity and being trustworthy to your clients and profession. Question 51. A client is learning to make their bed using forward chaining. They have mastered the first step, put on fitted sheet. When teaching the next step, you prompt them to do the first step, then teach/prompt the second step, put on flat sheet, and reinforce after they complete the first two steps. This is consistent with A. Teaching the steps in reverse order. B. Reinforcing only the first step until the whole chain is complete. C. Reinforcing the completion of the sequence of mastered steps plus the new step. D. Skipping steps the client seems to know. Answer: C. Reinforcing the completion of the sequence of mastered steps plus the new step. This question describes the reinforcement component of forward chaining. In forward chaining, after the first step is mastered, you teach the second step, and reinforcement is delivered after the learner completes the first two steps correctly. As more steps are mastered, reinforcement is delivered after the learner completes the growing sequence of mastered steps, plus the new step being taught. This links the steps together through reinforcement. Backward chaining teaches in reverse. A. You reinforce progressive steps, not just the first. B. Skipping steps might happen in total task, but forward chaining focuses on mastering the sequence. D. Question 52. You are assisting a BCBA with a functional analysis. In one condition, you present demands to the client and provide a short break, removal of demandee, contingent on the challenging behavior occurring. This condition is designed to test for which function? A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer: B. Escape. This question asks you to identify the function being tested in a specific functional analysis condition. In this condition, demands are presented, and the consequence for the challenging behavior is the removal of the demand, a break. When a behavior leads to getting away from something unpleasant, like demands, it is being reinforced by escape. This condition is designed to see if the challenging behavior increases because it allows the client to escape demands. The attention condition would provide attention. The tangible condition would provide an item. Automatic reinforcement is tested in a low stimulation condition. Getting a break from demands is testing for escape. Question 53. When a previously extinguished behavior temporarily reappears after a period of time where it didn't occur, this is called A. Extinction burst, B. Behavioral contrast, C. Spontaneous recovery, D. Prompt dependency. Answer C. Spontaneous recovery. This question describes spontaneous recovery after a behavior has been reduced through extinction by withholding reinforcement. It is possible for that behavior to suddenly show up again, even though you are still not providing reinforcement. This is usually temporary. An extinction burst is the initial increase in behavior when extinction starts. Behavioral contrast is when changing behavior in one setting affects another. Prompt dependency is relying on prompts. The reappearance of an extinguished behavior out of the blue is spontaneous recovery. Question 54. You are recording data on toy dropping. You define toy dropping as letting go of a toy such that it falls to the floor. If a client drops a toy and it lands on the couch, would you record it according to your definition? A. Yes, because it was a toy dropping. B. No, because it did not fall to the floor. C. Yes, because the behavior happened. D. You would ask your supervisor. Answer B. No, because it did not fall to the floor. This question tests your ability to apply an operational definition precisely. Your definition specifically states the toy must fall to the floor. If it lands on the couch, it does not meet this specific criterion of the definition. To collect data accurately, you must follow the operational definition exactly, regardless of whether it feels like dropping in a general sense. This highlights the importance of objective, clear definitions in ABA. Since the toy didn't reach the floor as defined, it's not recorded as an instance of the target behavior. Question 55. You are using a verbal prompt to teach a client to say cookie. You say cookie. The client says cookie. The say cookie is what type of prompt? A. Model. B. Gestural. C. Verbal. D. Physical. Answer C. Verbal. This question asks about the type of prompt used. A verbal prompt is when you use spoken words or sounds to assist the learner in making the correct response. Saying say cookie or just cookie are examples of verbal prompts. A model prompt is demonstrating the behavior. A gestural prompt is a movement. A physical prompt involves touch. Using spoken language to prompt is a verbal prompt. Question 56. When communicating with your supervisor, it is important to A. Only report positive information. B. Wait until the end of the month to share data. C. Report data and any important observations or concerns regularly and accurately. D. Only ask questions if you cannot figure something out after trying for several days. Answer C. Report data and any important observations or concerns regularly and accurately. This question is about your professional communication responsibilities as an RBT. Regular and accurate communication with your supervisor is essential for effective and ethical practice. You must share the data you collect and report any significant events, changes in the client's behavior, both positive and challenging, or concerns you have. Waiting too long. B. Or only reporting positive information. A. Prevents your supervisor from making timely, data-driven decisions. You should ask questions as needed. D. To ensure you are implementing procedures correctly and ethically. Regular, accurate reporting is key to effective supervision. Question 57. When a challenging behavior is maintained by access to attention from others, implementing an extinction procedure would involve A. Providing the client with their favorite toy immediately after the behavior. B. Physically preventing the behavior from occurring. C. Consistently withholding all attention, verbal, visual, physical, when the behavior occurs. D. Giving the client a brief timeout every time the behavior occurs. Answer: C. Consistently withholding all attention, verbal, visual, physical, when the behavior occurs. This question asks how to implement extinction for attention-maintained behavior. Extinction means stopping the reinforcement that is maintaining the behavior. If the behavior is happening to get attention, putting it on extinction means consistently not providing attention when the behavior occurs. This can be difficult, but is necessary for extinction to be effective. Providing toys, A, is for tangible function. Blocking, B, is response blocking. Timeout, D, is punishment. The core of attention extinction is the systematic removal of attention following the behavior. Question 58. A therapist is teaching a client to clap hands. They say clap hands and immediately clap their own hands, and the client imitates. The therapist then reinforces the client's clapping. The therapist's action of clapping is acting as A. Consequence. B. Prompt. C. Reinforcer. D. Punisher. Answer: B. Prompt. This question asks about the role of the therapist's clapping. In this imitation task, the therapist's clapping is an extra cue or help provided to make it more likely that the client will clap. This extra help is a prompt, specifically a model prompt, because the therapist is demonstrating the behavior. Consequences, reinforcers, or punishers happen after the client's behavior. The therapist's clap is the help provided before the client claps. Showing the client what to do is a prompt. Question 59. A child is learning to follow the instruction, sit down. Initially, you say, sit down, and gently guide them to the chair. Over time, you use less and less physical guidance until you only need to say, sit down. This is an example of fading which type of prompt? A. Verbal prompt. B. Gestural prompt. C. Model prompt. D. Physical prompt. Answer: D. Physical prompt. This question asks you to identify the type of prompt being faded. The key phrase is physically guide them, which describes a physical prompt. The process of using less and less physical guidance is fading that physical prompt. Verbal prompts involve words. Gestural prompts involve movements like pointing. Model prompts involve demonstrating the behavior. Reducing physical help is fading a physical prompt. Question 60. According to the RBT Ethics Code, you should always collect and report data. A. Only when the client's behavior changes significantly. B. Regularly and honestly. C. Only if your supervisor asks for it. D. By only writing down when the behavior did not happen. Answer: B. Regularly and honestly. This question is about your ethical responsibility regarding data. Accurate and consistent data collection and reporting are fundamental duties of an RBT. Data should be collected as specified in the plan, shared with your supervisor regularly, not just when big changes happen or when SDs, and always recorded honestly and accurately, even if the data doesn't look the way you expect. Data should capture what did happen, both occurrence and non-occurrence, depending on the measurement method. Your data is how the BCBA makes decisions, so keeping it regular and honest is essential. Question 61. A client's challenging behavior increases in rate, intensity, or duration immediately after you begin implementing an extinction procedure. This temporary increase is called A. Spontaneous recovery. B. Behavioral contrast. C. Extinction burst. D. Punishment. Answer: C. Extinction burst. This question describes a common and often challenging phenomenon seen at the beginning of extinction. When a behavior no longer receives the reinforcement it used to get, it might temporarily get worse before it gets better. This includes increases in how often, how hard, or how long the behavior occurs. This is known as an extinction burst. Spontaneous recovery is the reappearance later. Behavioral contrast is behavior changing in one setting affecting another. Punishment decreases behavior. The burst of behavior when you stop the payoff is an extinction burst. Question 62. You are teaching a client to identify objects by touch while blindfolded. You give the instruction, find the car, and the client feels different objects until they pick up the toy car. Successfully picking up the toy car is the behavior, and then you reinforce them. This behavior, controlled by a nonverbal stimulus, the feel of the car, and resulting in reinforcement, is an example of a mand. B. Tact. C. Echoic. D. Intraverbal. Answer. B. Tact. This question describes a tact under the control of a nonverbal stimulus, tactile input. A tact is when a person labels or identifies something in the environment. While most tacts are controlled by seeing or hearing something, they can also be controlled by other senses, like touch. The client is feeling objects and identifying the car, controlled by the feel of the car, not by wanting the car, mandi, repeating a sound, echoic, or responding in conversation, intraverbal. Identifying something sensed in the environment is a tact. Question 63. You are collecting data on screaming behavior. You are using a partial interval recording system with 5-minute intervals. Which of the following would result in you marking the interval as containing screaming? A. The client screams for the entire 5 minutes. B. The client screams for 10 seconds within the 5 minutes. C. The client does not scream at all during the 5 minutes. D. The client screams only at the very end of the 5 minutes. Answer. B. The client screams for 10 seconds within the 5 minutes. This question retests your understanding of partial interval recording. In partial interval recording, you mark the interval as occurring if the behavior happened for any part of the interval. Screaming for 10 seconds within the 5-minute interval meets this criterion. Screaming for the entire 5 minutes would also be marked, but partial interval doesn't require it to be the whole interval. C. Not screaming at all. C. Means you don't mark it. Screaming only at the end. D. Would be marked in momentary time sampling, but in partial interval, any occurrence works. Question 64. According to the RBT Ethics Code, when should you ask for supervision from your BCBA? A. Only when you are unsure about a specific procedure. B. Only during scheduled supervision meetings. C. Whenever you encounter a situation you are unsure how to handle, the client's behavior changes significantly or as required by your supervisor and policies. D. Only if a client's parent asks you a question you don't know the answer to. Answer. C. Whenever you encounter a situation you are unsure how to handle, the client's behavior changes significantly or as required by your supervisor and policies. This question is about your responsibility to seek supervision. You should proactively seek supervision whenever you are unsure about something, when a client's behavior changes in a way that might affect the plan, or if anything unexpected happens. Relying only on scheduled meetings, B, or waiting until you are completely stuck, A, or only when asked, D, is not sufficient. Your supervisor is there to support you and ensure ethical and effective practice. Reach out when needed and as required by your guidelines. Question 65. You are teaching a client to point to their shoes when you say, point to your shoes. You present the shoes and say, point to your shoes. The client looks at your hand, which is slightly pointing towards the shoes. Your subtle point is what type of prompt? A. Verbal. B. Physical. C. Model. D. Gestural. Answer. D. Gestural. This question asks about the type of prompt used. A gestural prompt involves using a movement or gesture, like pointing, nodding, or looking in a certain direction, to cue the correct response without physical contact. Your subtle point towards the shoes is a gesture indicating the correct item. A verbal prompt would be saying something more helpful, A physical prompt would be touching or guiding. A model prompt would be you pointing to your own shoes. The hint given by your body movement is a gestural prompt. Question 66. When using a timeout procedure, the main goal is to A. Add an aversive stimulus to decrease behavior. B. Remove the individual from a reinforcing environment to decrease behavior. C. Require the individual to perform an effortful task to decrease behavior. D. Withhold attention for a behavior maintained by attention. Answer. B. Remove the individual from a reinforcing environment to decrease behavior. This question asks about the purpose of timeout. Timeout from positive reinforcement is a punishment procedure where the individual is removed from the opportunity to access reinforcement for a specific period of time, contingent on a problem behavior. The goal is that this temporary removal from a reinforcing situation makes the behavior less likely in the future. Option A is positive punishment. Option C is overcorrection. Option D describes extinction for attention, not timeout. Timeout is literally taking a break from reinforcement. Question 67. You are implementing a behavior plan that includes a DRO, differential reinforcement of other behavior, procedure for hitting. This means you will reinforce the client if A. They hit fewer times than they did before. B. They engage in a behavior that is physically incompatible with hitting. C. They do not engage in hitting for a specific period of time. D. They engage in an alternative behavior instead of hitting. Answer. C. They do not engage in hitting for a specific period of time. This question asks you to identify the target of reinforcement in a DRO procedure, in differential reinforcement of other behavior. DRO. Reinforcement is delivered if the target problem behavior, hitting, does not occur during a specified interval of time. You are reinforcing the absence of the problem behavior or any other behavior besides the target one. DRL. A. Reinforces a lower rate. DRI. B. Reinforces an incompatible behavior. DRA. D. Reinforces a specific alternative behavior. Reinforcing for not doing the problem behavior is DRO. Question 68. Maintaining client dignity involves A. Talking about the client's behaviors in a public place. B. Treating the client with respect and protecting their privacy. C. Only working with clients who have mild challenging behaviors. D. Making all decisions about the client's treatment without their input. Answer. B. Treating the client with respect and protecting their privacy. This question is about maintaining client dignity, a core ethical responsibility. Treating clients with dignity means respecting them as individuals, honoring their preferences when possible, maintaining their privacy and confidentiality, and avoiding language or actions that are demeaning or disrespectful. Discussing client information publicly, A, is a breach of privacy and dignity. The severity of behaviors, C, does not determine dignity. Making decisions without input, D, disrespects autonomy. Always treat your clients with the utmost respect you would expect for yourself. Question 69. When implementing discrete trial training, DTT, what typically happens immediately after the client provides the correct response? A. The therapist provides a prompt. B. The trial ends with no consequence. C. The therapist delivers a reinforcer. D. The therapist repeats the discriminative stimulus. Answer. C. The therapist delivers a reinforcer. This question asks about the consequence step in a typical DTT trial for a correct response. In DTT, if the client performs the target behavior correctly, or correctly with a prompt within the procedure, the therapist immediately delivers reinforcement. This consequence strengthens the desired behavior. Prompts A. Happen before or during the response, ending with no consequence. B. Or repeating the SD. D. Would not reinforce the correct behavior. For a correct response, the immediate delivery of reinforcement is crucial. Question 70. You are collecting data on a student's compliance with instructions. You measure the time between the instruction being given and the student starting to follow it. This is a measure of A. Duration, B. Frequency, C. Latency, D. Inter-response time, IRT. Answer C. Latency. This question retests your understanding of latency. Latency is the time between a stimulus, the instruction, and the start of the behavior, starting to follow it. Duration is how long the behavior lasts. Frequency is how many times it happens. IRT is the time between occurrences of the same behavior. Measuring the wait time before they start following the instruction is measuring latency. Question 71. Your supervisor asks you to take data on property destruction by counting the number of damaged items at the end of the day. This is an example of A. Frequency recording, B. Duration recording, C. Permanent product recording, D. Interval recording. Answer C. Permanent product recording. This question asks about a measurement method that involves counting the tangible results of a behavior. Permanent product recording is when you measure a behavior by counting the lasting effects or outcomes of the behavior on the environment, rather than observing the behavior as it happens. The damaged items are the permanent product of the property destruction behavior. Frequency records the behavior as it happens. Duration times the behavior. Interval recording samples the behavior within time blocks. Counting the resulting damaged items is permanent product recording. Question 72. Which type of verbal behavior involves answering questions or engaging in conversation where your words are controlled by other people's words? A. Mand, B. Tact, C. Echoic, D. Intraverbal. Answer D. Intraverbal. This question is about intraverbals. An intraverbal is a type of verbal behavior where the speaker responds to another person's verbal behavior, but there is no point-to-point correspondence. It's not just repeating, and no nonverbal cue. Examples include answering questions, "What's your name?" filling in the blank, "Twinkle, twinkle little," or general conversation. Mands ask for things, tacts label things, echoics repeat things heard. Responding verbally to someone else's words in a conversational way is an intraverbal. Question 73. Before you start working with a client, you should review the client's behavior plan or skill acquisition plan to understand. A. Only the client's diagnosis. B. The specific procedures you will implement and the data you will collect. C. Only the target behaviors you need to decrease. D. How long the session should last. Answer B. The specific procedures you will implement and the data you will collect. This question is about your responsibility to understand the plan. As an RBT, you are responsible for implementing the plan as written. This requires you to understand exactly what procedures you are supposed to use for teaching skills and managing behavior, and exactly how you are supposed to collect data on those behaviors. The plan tells you your role and actions. Diagnosis, A, is not your primary focus. Plans often include both skill acquisition and behavior reduction. C, session length. D is usually scheduled but is only one small detail compared to understanding the core procedures and data. You need to know exactly what to do and how to measure it. Question 74. You are working with a client and a significant unexpected behavior occurs that is not addressed in the current behavior plan example. The client suddenly becomes aggressive, which they have not done before. What should you do first? A. Implement a punishment procedure you think might work. B. Continue the session as planned and hope it doesn't happen again. C. Ensure the safety of yourself and the client and contact your supervisor immediately. D. Ask the client's parent what they usually do in this situation. Answer C. Ensure the safety of yourself and the client and contact your supervisor immediately. This question is about handling unexpected and potentially serious situations. Your first priority in any challenging situation is always safety. yours and the client's. If a significant unexpected behavior occurs, especially one that could be dangerous, you should ensure everyone is safe and then immediately contact your supervisor. As an RBT, you are not authorized to implement new procedures, A, or make clinical decisions on the spot, B, D. Your supervisor needs to know about the behavior right away to determine the appropriate response and potentially update the plan. Safety first, then supervision. Question 75. Which ethical principle requires RBTs to practice only within their areas of competence and training and to seek supervision for tasks outside their expertise? A. Responsibility to clients. B. Integrity. Be truthful and honest. C. Maintaining competence. D. Professionalism. Answer. C. Maintaining competence. This question is about practicing within your skill set and seeking support when needed. The ethical principle of maintaining competence means that behavior professionals should only perform tasks for which they have been properly trained and are competent. For RBTs, this specifically includes practicing within their defined role and scope, under the supervision of a BCBA, and seeking guidance whenever a task is outside their training or comfort level. Responsibility to clients is broader. Integrity is honesty. Professionalism covers many aspects of conduct. Practicing within your limits and seeking supervision for anything new is crucial for maintaining competence.